The World Primary Immunodeficiency Week is a global campaign that raises awareness and improves diagnosis and treatment of primary immunodeficiencies, taking place between the 22nd and the 29th of April. It has been extended until the 1st of July due to the COVID-19 pandemic. Children and adults who fall ill with recurrent or more severe infections may suffer from an undiagnosed underlying primary immunodeficiency disease, which is of increased concern during the COVID-19 pandemic. This week, it aims to create awareness on what immunodeficiencies are and assist in advising on the necessary measures that one can make in order to ensure better health. But to tell us more, we joined via Skype by Professor Claudia Gray, who is an Associate Professor of Paediatrics and Allergology at the Kidsallergy Centre, Vincent Pallotti Hospital and the Red Cross Children Hospital. Professor, a very good morning to you. Thanks for joining us. Welcome.
Good morning, Sampira. Thank you.
Do explain to us in layman terms what immunodeficiencies are and what are the root cause of it?
So immunodeficiencies are essentially a fault with the immune system. Your immune system is there to fight infections, and most of us are born with a great immune system. But some people are born with a fault or a dysfunction in their immune systems, which has many different parts to it. And that's termed a primary immunodeficiency. And if you have such an immune problem, you will not fight infections as well as other people. And you may well get other complications such as autoimmunity or even cancers.
Now, the World PI Week, Professor, has been extended until July. So why was this decision taken? And, what are you hoping to teach the public about immunodeficiencies?
Yeah, so the main reason for that is obviously the current COVID-19 epidemic and the concern that people who have a dysfunctional immune system may possibly be more prone to complications of an epidemic such as that we're seeing at the moment. This is based on common sense rather than hard evidence, but certainly people with a severe immune deficiency, especially those with complications such as lung disease, should take special care during a worldwide epidemic such as the coronavirus epidemic that we're seeing at the moment. And whilst taking special care, they also need to make sure that their underlying conditions are very well controlled. And one of the main entities that we would like to make people aware of is that if you do have an illness, such as allergies, asthma, or immune deficiencies, do make sure these conditions are well controlled at the moment. Go to your regular doctor, continue with your regular medication, continue even with your immune suppressing medications, because your underlying condition needs to be in tip-top condition so that you can fight the coronavirus well.
Professor, there are those patients who suffer from undiagnosed underlying primary immunodeficiencies. So is there perhaps a mechanism of, diagnosing those immunodeficiencies? Because in some instances, they live with those immunodeficiencies undetected and undiagnosed. And the minute those deficiencies strike, they strike the patient to a point of no return in some instances.
In some instances, yes, but we do hope to catch them before real complications occur. So you're quite right. It's sometimes hard to differentiate between normal colds and flus, especially little children who can get ill up to 10 times a year if they're in childcare or creche, for example. And that can be part of a normal spectrum. But there are some warnings, some red lights, some warning signs for primary immunodeficiencies. And we use the acronym SPUR, such as our SPUR state ranches, SPUR. And the S stands for severe. So if you or your child is tending to get more severe infections than most, then this is a potential problem. The P stands for persistent. So if you find that you battle to shake off illnesses, then it might be a pointer. The U stands for unusual. So if you get odd or weird or unusual infections, possibly have it investigated. The R stands for recurrent. So if they keep on coming back or even resistant to treatment. So if you have those signs, severe, persistent, unusual or recurrent infections, you may well, or your child may well, be harboring an underlying immunodeficiency. And it's fairly easily tested for if you go to your primary doctor, your pediatrician, physician, or indeed your specialist allergist, immunologist. And at this stage, I'd just like to tell your viewers as well that we have a wonderful allergy foundation in South Africa, which has lots of information on conditions such as immunodeficiencies. www.allergyfoundation.coza, and they run courses and training courses for doctors and even for interested public members. So essentially, conditions which are severe, persistent, unusual, or recurrent. Have a think about whether this is within normal range or perhaps beyond that.
You know, Professor, it's absolutely vital that one has a very strong immune system, because some experts have even suggested that the coronavirus, for instance, can be fought off without the help of, medical treatment, because some of the immune systems can actually fight off this disease on their own. And having said that, what are some of the preventive measures to avoid infection, especially to those who already have compromised immune systems?
Yeah, Sampiwa, that's a great comment. Remember that 80% plus of people do get a mild version of coronavirus. Yeah. So it's only 15 to 20% who have a more severe form of the disease. Mm-hmm. But we have heard widely now about preventative measures. Prevention is better than cure, we always say. So the standard measures that the government has really tried to implement: social distancing, wearing masks when you're outside of your house, frequent, prolonged hand washing. We always say sing happy birthday twice while you're washing your hands with soap and water, and frequent sanitizing of the hands. And in addition to that, as a prevention measure, make sure your underlying conditions are very, very well controlled. As I mentioned, your asthma, your diabetes. If ever, this is a time to eat healthily and exercise. The main risk factors for coronavirus complications in huge studies in the UK, for example, have of course been age, cardiovascular disease, obesity, diabetes, underlying cancers, and underlying chronic chest diseases. So if you have any of these underlying disorders, make sure they are very well controlled. And this includes our group of immunodeficient patients.
Professor, great chatting to you. Thank you so much for your reflections and for your insights. Much appreciated. And I guess the crux of the matter now is to diagnose immunodeficiencies much, much earlier. That was Professor Claudia Gray talking to us about World Primary Immunodeficiency Week, extended to 10 weeks, or rather extended by 10 weeks due to the COVID-19 concerns. Let's take a quick break now. We'll be right back.
Information. Yes, information is the most treasured commodity right now as the world battles the COVID-19 pandemic.